I am Dr. G Rajan, consultant orthopedic surgeon practicing in Bangalore Narayana Hospital. In the acute stage, when the pain is severe, anti-inflammatory medications along with physical therapy modalities like ultrasound and interferential therapy is commenced for a short period of 5 to 7 days. Once the acute pain subsides, and for patients who experience occasional pain, exercise therapy is commenced, wherein the kneecap stretching and strengthening exercises is recommended for a minimum of 3 months. These exercises are specifically designed to combat muscle imbalance and improve the knee alignment, improve the kneecap alignment particularly. In addition to this, knee braces and tapes can be used when you're walking on uneven surfaces. Most important is modification of fitness activities. We particularly recommend low impact activities like swimming and cycling or cross trainer use to minimize the impact on the kneecap cartilage.